Hey class, welcome to Abroad Sex Education, where we talk about everything you wish you learned in school. I'm your host and pupil of the penis, Sin. In this episode, we're flipping the script. My classmate of the cock is Brooklyn.
Present.
And our guest lecturer is our resident penis owner, Asa.
Wow, look at me getting a chance to talk about things I'm very qualified to talk about.
Yay!
This podcast is a sex education resource intended for an adult audience. We'll be having real, inclusive conversations about sexuality, pleasure, relationships, gender, identity, and more. Some topics may be considered explicit or sensitive, especially in today's lesson where we will be discussing male genitalia. Our goal is to help break the stigma around sexuality and provide the kind of education many of us never got. We're learning too, and bring what we learn straight to the classroom so we can all grow together. You deserve to know what this is about, so you can make an informed choice to listen, or not. That's what consent looks like, even here.
I didn't feel like I could speak on this topic as well as someone who has a penis. And I also don't feel like I learned a lot about the penis. So felt like this was a good...
Like in school.
In school. So I also felt like this was a good episode to pass off to you. We're going to be talking about dicks.
That's the keeper. That's the keeper cut
Yeah.
right there.
I'm just talking about some dick.
Are you excited, Bubby?
I'm excited. I will put in some caveats. I am extremely certified in saying I'm not a doctor, but I could probably point to some parts correctly 80% of the time. I probably am like semi-confident about some of the terms. So we'll see how that goes, but you know, we'll have a good time with it.
Yeah, we're going to figure it out. The whole
Yeah.
point is we all learn together. What did you learn about the penis when you were in
school?
Or just in life, like when you're growing up?
I mean, I feel like we saw the anatomy of it.
Mm-hmm.
I don't remember at what point I learned about like it getting erect and coming up. This was not in the curriculum when they first introduced sex, and I talked about that in episode 1 about how I was confused. I obviously knew that like boys had penises, girls had vaginas. That was, you know, the biology of it at the time. And I feel like everything else was just like street education. Yeah.
Locker room talk.
Yeah.
Yeah.
I was in a lot of locker rooms talking about penis.
I think we all were in middle school.
Yeah. I mean, I do own a pee-pee shrine because I'm a big fan of them. And I went to the Penis Museum in Iceland. So saw a lot of penises, a lot of animals.
I don't think when I was in school we learned anything about it. At least, you know how like they separate the boys and the girls. So the girls just get like, here's what your period is about.
Yeah.
And then guys get whatever they talk about.
Yeah.
Like they never taught that same lesson. I think it was only a few years ago when I really saw the inside of what a penis looks like, or the anatomy on the inside versus the uterus. When they talk about women's reproductive systems or women's sex organs, they always show like the uterus. They only show the inside. But with men's reproductive and sex organs, I only ever saw the penis.
Because I think a lot of the education portion was focused on pregnancy. And so we did see a lot of uterus because it was like, well, the sperm's gone. Like, here's a sperm. We saw a lot of sperms and less penis.
Probably a lot of like the reproductive cycle too, right? Like, oh, the egg is fertilized and we
Yeah.
see like the egg in the like womb growing, blah, blah, blah. I think that was a common thing that even the guys got too, because part of like human development rather than just like, but then you're seeing, you know, the internal and the female anatomy, right?
Right.
Yeah. I did want to say, like, I think that I remember in high school or middle school getting the anatomy part of it from both sides, female and male reproductive systems. But I don't think that we went into as much detail on the menstrual cycle and all that. Like, that was very much more so on the female side.
Oh, you didn't learn anything about like periods.
I mean, we did kind of, right? Like, we learned that it was a thing that happens to women, but it wasn't nearly as, I think, perceiving how you guys talked about it, like how much level of detail it was. But
Yeah, I think when we talked about how puberty worked in boys, it was like voices get lower and then hair will grow everywhere and then there's a growth spurt. It was very like, oh, all these rapid things will happen that are just physical things that will affect their body. And it was never like, oh, They're
The
horny all the
anatomy
time.
side. Yeah.
Yeah. My best friend growing up, her mom was a nurse and she had books in their home library about sex education and things. And we read those on our own. So sometimes I forget, like, where did I see, how did I know that?
Was
So a
it
lot
school or was it just on
right.
your own?
I just like me going through her library, I mean, with my friend.
Yeah.
Yeah, we would read and learn from
I
those.
feel like most kids kind of put things together in a combination of things like that. Like,
Right.
I really doubt that any kid learned everything from their school program,
Right.
like ever, especially like anatomy stuff. Like, I don't
Not in
think.
America.
Yeah.
Right.
No.
And I mean, unless you had a teacher that was like, this is very important, I firmly believe this,
Right.
versus like, what do a class of 8-year-olds need to know? What do a class of 16-year-olds need to know?
I vividly remember having one of the sex education days or whatever, and I remember the professor wheeling in the dolly with the old TV
Yeah.
with the VHS tape of something recorded in the 70s to like talk about like the anatomy of whatever. And I remember thinking like, there's no way this is the peak level of information that we have. Like, as like a teenager, I
You're
was
right,
like,
because it's only available on VHS.
Right.
I know exactly what you're talking about because I've seen it too. She has full bush, so you know it's from the 70s. And like even in college, I was like, is this the best tech that we have? Like, where did you find this TV?
If you gave me a blank map of female reproductive and sex organs and male reproductive and sex organs, I think I would get 100% female organs, but for male, I think I would only get maybe 50% to like 60%. But that's just because it's been a few years when I think I first saw it. And I was like, oh, I wonder why I never thought to look inside of what that looks like.
I feel like I would score higher, but this might be like a false sense of confidence. I feel like I would get like a 90%. But
Not
maybe
the
I'm-
outside, on the inside too?
Yeah.
Oh,
that's what I
really?
think. Yeah.
Nice.
That's what I think. I'm confident, but like maybe for no reason.
I believe that you could totally give this lecture then, because me looking through the anatomy like
Yeah.
pictures, oh, I scored like 20%, if that.
Okay, well
if
now
that.
I feel like maybe
Yeah,
I
yeah, yeah.
don't know what
Well,
I'm
no,
talking
I think
about.
I think part of it, right, is like this kind of anatomy stuff. You get taught it in middle school or high school, and then I never think of it again, right? Like some of these terms, I swear I remember writing these terms in like a quiz. And then it doesn't come up ever again, right? It's never like you go in and talk about parts of the penis to your doctor. Like it just never, it's not a conversation. Whereas the menstrual cycle and women's anatomy is like so, I feel like as a man, obviously I don't know shit, but like I feel like I hear you guys talking about, cramping and like everything else very frequently, right?
Yeah.
Men do not talk about their penises like at all. Like there's no conversation about that whatsoever.
Anyone that has a uterus is so conscious about their cycle because hormones that are affecting different parts of our body. So, or running our body really. So I can understand why there is not so much conscious thought about penises as there are about uteruses and vulvas. Mostly your uteruses, actually.
When we women go to the doctor more regularly, like specifically the gyno more often, men would only go to the penis doctor if something were wrong. And I don't think they would talk about it to their friends because there's such probably like a sense of shame around that. So they wouldn't talk about it then.
Ever once talked about penis stuff at all with any of my male friends ever. Like seriously, like I don't
Let's
think
change
it's
that. No, I'm just
yeah. Like it's just not common, right? It's just
Yeah.
like I think there's a stigma around it and a sort of sensitivity around it. I feel like enough guys now have a sort of impression about, oh, it's like a taboo thing. Like we don't want to talk about sizes or whatever. It's like you're walking on eggshells, right? And I think that even when you go to like places where you might see somebody's penis, right, like at a gym or a spa or something like that, you kind of like hush hush, like you know, I don't want to be seen looking in the general direction of this guy. You know what I mean?
I was going
Like,
to ask that. Like,
Yeah.
because men's bathrooms are so open and locker
Right.
rooms.
It's very
Nobody's-
much like eyes up top, no one's looking down. I've like not really ever seen anybody like checking you out, It's a rare occurrence.
There is apparently a whole like bro code about like where if one stall is open, like where do you stand?
Oh,
Which
I've
stall
seen-
do you go
yeah.
to?
Yeah, there's literally a like little flash game on the internet where like the levels are like here's all the urinals, where do you stand that's the farthest away from the next man in the tray, right, in the series, right? And then you have to like judge it of like, oh, well, this one's like a taller guy, so I'm gonna go even further away, right? Because like it's like very.
This could be like that social, you know how they talk about like if you get in an elevator but face the wrong direction, instead men should go into bathrooms.
Purposefully go to the next closest stall.
Yeah, start a conversation with the guy next to you.
Do men have a doctor specific for the penis?
Not that I know of. I think the closest thing would be like going to get like a prostate exam. That's like really...
But that's a general practitioner that does it, right?
I don't know. I have never gotten one, I don't know the answer.
This is why I think there are penis doctors. I swear on The Bachelorette years ago, there was a guy and his job was penis doctor.
I guarantee you it's a job. I have never heard of anyone going to a penis doctor.
They're never going to tell you, right?
What exactly, right? It would not come up in conversation.
Right.
I'm going to look it up.
Oh, for sure.
It might not be called penis doctor.
Yeah.
That's not the medical term people go to school with. Urologist is a medical. Okay. So it's the penis, testicles, and a prostate. So I've heard of urologist, but I thought it was just like prostate.
I thought it was pee stuff.
Oh,
like
okay.
Right.
I don't know why urine. I think in my head I was like, oh, it's the tube.
Yeah.
That you pee out of, and so I thought that was the guy.
Yeah. Okay. Cool. Why do you think we talk about penises so much in society, but actually teach so little about how they work?
See, as a man, I don't necessarily think that we don't teach how they work, right? Like, I feel like I was appropriately educated in terms of, you know, anatomy of it and whatever else, right? I do think that there is a cultural shame / taboo about just conversing about it, right? But I don't know.
I would not have gotten that given how we are in the world today about men feeling uncomfortable to talk about their penis. Because I think there's a common notion, especially with, women, that like, oh, these boys in their locker room talk. Like, we all think y'all are just going locker room and comparing dick sizes. And like...
Never seen that in my life.
I think they're bragging about women.
Yeah.
Like, probably lying. But like, I feel like if a guy had like a ridiculously large penis, he would be like waiting for somebody to look in the locker room.
Yeah, I feel like it's more of a... I thought men were a lot more open about it.
No.
I've talked to several straight men about like I was like, you've never seen... Like, I've seen many of my close female friends naked. And I was like, you've never... Like, that was shocking to me, but I found that out.
Most men do not like to go to places where they are seen naked. I mean, I think most people go... When they go to the gym, they're like, quick change, get myself changed, get out. Like, there's no, like, lingering in the locker room having a chat. Like, it's not really...
You guys don't have, like, drinking nights where you're
like, just sitting out with your dick out? No.
Yeah.
No. Yeah. Really.
Well, I've done that in college. Yeah. Girls were like, all right, let's do it. No? Okay.
I did do something similar where it was like another woman and then two gay friends. So I was like,
okay.
It was like non-threatening.
Yeah.
Like, I was like, oh.
Yeah, no, like,
what does your body look like?
Yeah, and then I feel like girls like compliment each other. Like, you have nice boobs. And you're like, thank you. Like, yeah, like, guys don't do that though.
No.
No one's like, wow, what a great dick.
Yeah.
Like,
yeah.
I feel like maybe it's like the men are informed and then there's like an air of mystery around it for the women when in education when you're learning about it.
It could be. Yeah, it could be. I feel like, I think that I don't know if I can speak on behalf of all men. Also, I'm not like a big gym guy, right? So like, I don't know if I can accurately speak generalizing across all gyms, but I've never been in a space where there are naked men around where there's any level of conversation other than like the bare minimum of like, hey, that's my locker or something like that. It's very like...
Is a Korean spa like that?
Yeah.
Yeah. Hella talking in the Korean spa.
Yeah.
No, not... I've never really experienced a lot of talking. Usually, like, if you're in a spa room, like the men's spa room is like dead quiet.
That's so weird.
Dead
it's like a
quiet.
library in there.
Yeah, it's...
Yeah,
Well, 'cause, like,
I'm like,
literally-
did someone die? What
Oh,
is
that's
going on?
fascinating. So the women is like a chat room?
Yeah, yes.
Talking.
Every spot. I mean, like, I'm talking like Blue Lagoon in Iceland. Like,
Wow.
it's chatting, you're talking.
I think there's
making
even in the spa that I go to the most, there's a big giant like, please be quiet sign. Like genuinely. Yeah.
Oh, don't make him.
No. And like you usually see guys, so because like Korean spas is a great example, right? Because like you go in the room, there's like a spa room, like whatever, and like most men will go in there, they will have a towel, and they'll put the towel over their penis, completely covering it, and they'll put their hands like in their head or whatever, just like sit there for like 5 minutes or whatever, and they'll leave, right? Like that is the routine experience that I feel like most spa goers on the male side experience, right? It's a very like non-communicative.
It's an individual thing.
Yeah.
Experience.
Usually if there are people talking, it's like, you know, you're looking at them, right? Like
Oh.
judging a little bit.
Okay.
For sure.
Literally, when we went to the Korean spa, that was the first time I went with a group of friends. And yeah, just like me and our two other friends, just like in the shower, gabbing along, just like taking the shower right next to each other. Because
Yeah.
you know how they make you shower beforehand.
I think that like there are conversations that happen in the male side of Korean spas, right? But it's usually like when you're covered and when you're like, I'm like underwater, right? And I'm like conversing to the fellow man next to me who's also underwater, right? Like there's not really many like full frontal discussions happening, I would say. Yeah.
Wow. I didn't know that.
Yeah.
Yeah. Well, and then, yeah, because imagine like if a guy was erect, then that would be like very taboo in that situation. So the code is like, don't look, don't ask, don't tell. Don't look, don't talk about it.
Right. Could be. Again, there's also could be extremely biased, right? Like I've only been to a couple different Korean spas and like, but that has been my experience both here in the US and then also in Asia.
Yeah.
Yeah.
And I feel like every like straight man with male friends that I've talked to, same feedback. They don't really know much about their
Yeah.
friends' penises.
We're already learning things. Yay.
Hey, you can lead the class, professor.
Right.
I slept with the professor.
I'm like, I think I would get a 90%. She's like 60%. I'm like, how? He's giving you an F for sleeping with the professor. This guy is very adamant about his work.
We're all business here, you know. If you didn't learn the material,
You have to
I
retake
can't
the
help
class.
you.
Yeah, that makes sense.
Yeah, so today's lesson, I kind of wanted to blast through a couple different topics. So first we're going to talk about a brief anatomy tour. We're going to go through a single slide of just a bunch of anatomical features of the male anatomy. And then we're going to go through some numbers. So we'll do a math section about some averages, some myths, and what is actually normal. Then we'll do an anthropology section and talk about culture, some language, and then, you know, the shame that kind of shapes the story of the penis. And then we'll finish up with some science questions, and this will all be pretty much all about sperm. And so things like speed, survival, and surprising statistics. Y'all ready?
Yeah.
All right. All right, so let's start with health. We're going to talk about male sex and reproductive organs. Like I said, I only have one big slide with a bunch of terms here. So this is kind of a major overview of the male reproductive system. So I feel like most people, when they think of the male reproductive system, are primarily thinking about the external structures, right? So like the actual penis and the testicles, right? There's a lot of parts inside, and there's a lot of piping that kind of connects everything together. Instead of starting from the exterior, I'm going to start from the inside with the testes, actually. So the testes are basically the place where sperm is actually produced, as well as testosterone, which you're probably familiar with. And as the sperm is produced, it is like it's kind of hung in this little sphere, which is packaged and attached to the male body in the scrotum, which is basically just like a skin flap that kind of holds the testicles there. Epididymis is the coiled wiring around the side of the scrotum, right? And the actual tube that takes sperm from the testes all the way up to the rest of the internal system is the vas deferens. So when people talk about having a vasectomy, that is what's involved in cutting or modifying this tube, which is responsible for piping the finished, finalized sperm ready to perform reproductive functions into the rest of the system. So you have a vasectomy, you're basically vasectomying, ectomy, a removal. You are removing the passageway of this, you're basically cutting, right, this tube, and therefore you might be able to ejaculate, but you will not have sperm, right? Because the sperm is no longer being sent to the rest of the system.
Did you know after you have a vasectomy, you have to go get checked again by the doctor to make sure that it's still cut because it can heal itself and then you could have an unwanted pregnancy.
Yeah.
Yeah, because like most body parts, given enough time, have the ability to like heal themselves, right? Like if you get a wound, your skin reforms the tissue, right? So same thing here, right?
There's
Yeah.
a new birth control for men. It's with the FDA right now. Like it's not officially out, but they essentially inject some solution into the vas deferens and it just blocks all the sperm from being able to reach the seminal vesicle. So
That makes sense. Yeah,
yeah.
it's basically like a pipe. You block the pipe, then
Yeah.
you can't send it through.
It's supposed to like last 3 years. And so it's like it's kind of like getting the implant. So I thought that was cool.
That is very cool. That sounds really easy.
Yeah.
It's just like a shot.
Versus this is like not a serious surgery, but it is a surgery, right? You are modifying your body by like cutting some connective parts, I guess. Anyway, so you have this tube, basically this like tiny little pipe that sends sperm up, and it gets hooked into this little thing at the back of the bladder called the seminal vesicles. And those are where semen is produced. So semen is a fluid that kind of carries the sperm around. So seminal vesicles, according to some number that I found on the internet, hashtag medically trained, 60% of the semen is produced within this little vesicle area at the back of the urethra.
So, quick question.
Uh-huh.
So, semen is just the thing that helps guide the sperm through.
Yeah. If you ever took a chemistry class and you talked about like, I'm going to dilute something, right? And I'm going to put something that's really concentrated in some kind of a buffer solution to make it really distributed. Semen is kind of like that. Or let's say you buy a medicine, right? Like a pill. The actual concentration of the medicine that you get is very small. And the rest of the pill is just a bunch of pieces that digest down to distribute out to your body, right? Semen is kind of like that. It's just like a fluid to like carry the actual sperm. That's all it is.
I have a question. So I was having this exact conversation with my friend the other day about the amount of semen, and I was like, well, that wouldn't necessarily mean lower sperm count, yada yada. But so my understanding was that semen, like sans sperm, that it's just like mucus, like your body produces mucus. Is it the same substance?
I don't think it's the same as mucus straight up, but it's a similar consistency,
Yeah.
right? Like it's almost like a kind of a gooey, slimy substance,
Yeah.
right? Yeah. I don't know if it's related to mucus production, but
Okay.
pretty sure that's just like your
Nasal.
nasal passage rather than
I see
anything. Like,
gland. I don't know.
yeah. Again, not a doctor. So once you have this fluid, which is obviously a combination of the semen and then the sperm, that kind of mixture connects from the vas deferens, which again is just like a tube, down past the seminal vesicles into this little duct, this ejaculatory duct. And that duct is responsible for merging that vas deferens and then the seminal vesicle, and then emptying the contents of that fluid directly into the urethra. So earlier we talked about the urinary tract, right? This the same tube that comes from the urinary bladder is also responsible for carrying the fluid of the semen and the sperm out through the rest of the penis. So it's one single pipe that sends both. Kind of like how the vagina is used for both intercourse and menstrual bleeding and everything else. Same thing here. The urethra is the one and only pipe. So then you have this little tube, right, that goes and flows through the prostate, because the prostate gland is basically there to add an extra fluid to the semen. It can make the semen more mobile, I guess, or like more viscous, I guess you could say, right? Which means that the sperm can like move through the rest of the system more quickly. And then once you have that, again, combined stuff, it goes past this additional gland, the Cowper's gland, which is also called the bulbourethral gland. And basically it adds pre-ejaculate. So the first sort of like initial reaction that a man has to ejaculation is a separate fluid that has like additional lubrication, right? And that's for pushing the very initial amount of the ejaculant all the way through the urethra. It's almost like if you were in chemistry and you had like a little pipette, right? And you prime the pipette with something. That's basically what this is. It's like a primer, I guess you could say. Apparently, the Cowper's gland helps neutralize acidity of the concoction of the semen and stuff. So you have this fluid. It's been passed through all these glands, and now it's getting sent through the urethra, which again is the same pipe that passed urinary fluids, and it goes through the rest of the penis. So when people talk about the shaft of the penis, that is basically like the long tube-like section, but there's actually two distinct parts of that quote-unquote shaft, right? So the corpora spongiosum is kind of like the bulk of a flaccid penis. It's like all of the undercarriage, almost, you could say. And it's this spongy sort of extra protection that covers and surrounds the urethra. Because the urethra is so important in terms of a channel for reproductive fluids, it's basically a padding or an insulation is the best way I could describe it, right? Around the urethra. And that's very different from the corpora cavernosa meaning like lots of cavernous cells. That is the portion that actually fills with blood. The undercarriage does not fill with the same amount of blood as the top part. Now, you might not be able to tell that if you're looking at an erect penis, right? But this corpora cavernosa is basically filled with all of these spaces where blood can circulate and like inflate. It's actually, this diagram doesn't do a great job of showing it, but there's kind of actually two parallel, almost like balloons, you could kind of say it, on the top part of the penis, and those are the places where it inflates with the most blood.
Just in the front? Like,
just on the top, separate from the bottom side, which is to kind of hold that urethra. I don't know if it actually protects the urethra during like flaccid times when you're just using it to pass urine, right? I don't know actually about that, but
So the spongy part gets hard, or the cavernosa gets hard?
the corpora cavernosa is what fills with blood, and so this is the part that's actually quote unquote inflating. The lower part, I'm not confident if there's 0% that's growing, but by far the vast majority is in the top part of the penis, for
That's
sure.
why a lot of penises point upward.
mm-hmm. That makes sense, right? That's why I was like, what? Just the top? I just found that out.
Yay, I taught the expert, the
I
penis
didn't know
expert
the
of the room.
penis term because I love that word.
Yeah.
I also didn't know about the pre-cum. You taught me that too.
Anyways, so then you have this fluid which is now passing through this urethra, and which is now in the erect penis, and then it gets sent out through the glans penis, which is actually like the head, the end, the tip, right? Whatever you want to call it, and then into wherever other places that the semen and sperm end up going, right? Yeah. Does that kind of make sense? The full package? Questions?
I do have some questions. So, when you're hard, but then also need to pee, is there an issue there because now your body's like primed and ready to send out semen, but then now you gotta pee? Like, can you pee with a hard penis?
You can. It's more difficult, I would say. As a man who has needed to pee sometimes and has happened to have an erection, when you go to the bathroom, right? Like it actually helps you get rid of the erection to pee, because you have to like intentionally be like, oh, I want to pee now, right? And I think that something about that, it's almost like it feels like a very different bodily function. It doesn't really feel like the same thing at all, I would say. Good question. Anything else?
So, just for external, it's mainly just like the scrotum, the head,
Shaft.
the
Yep.
shaft.
That's pretty much it. Yeah, that's all you'd really see from the outside. You would see the skin, obviously, around these two parts of the shaft, and then the head, and then the scrotum.
So the prostate is also,
So this is the rectum. What's
Yeah.
the proper term, right? So this is very close to the prostate, right? That's why when you get a prostate exam, this is typically the access point. You know.
or the perineum,
Mm-hmm.
which is the spot between the scrotum and the anus.
Oh, that's the medical term for it?
Perineum, yeah.
Casually known as the gooch.
The gooch.
Yeah. You
I've never heard that.
Oh my God, yeah. No, so like men have gooches and then women, it's the taint.
I've never heard of the gooch.
Really?
I've heard
Nah.
of it, but I've never
Oh,
heard of
yeah, it's a gooch. It's
Taint's a widespread term. Gooch is never. Like, it's like
No,
the Grinch. Like,
in my world, gooch is specifically men. Taint is women.
never heard the term gooch. It's like a Dr. Seuss
it.
character.
Was just
Yeah.
your butthole.
No, it's between like if you were in labor And then it split open, right? Like to your butthole. Like the baby ripped your taint to your butthole. Yeah.
Okay.
Very pleasant.
Yeah.
Cool. All right, let's move on to math. So I kind of wanted to put in some facts and figures here. I think there's lots of interesting numbers that we can talk about for the penis. So let's do it. First one, I want to talk about sizes because that's fascinating, right? I think that this is an important conversation because there's a lot of preconceptions that go along with this. It's actually a really interesting sort of like scholarly history behind this. So for the numbers that I'm showing on the next couple of slides, I'm going off of this particular study, Veale et al. In 2015, which was a kind of a major meta-analysis, you could say, of a bunch of different statistical data collection from other scholarly reported sources that specifically were clinician measured. And why does that matter? Because there is actually a very strong history of self-reporting or survey-based reporting in medical history when it comes to penis measurements, and people like to skew those results. And so there tends to be a problem with data that doesn't come from clinicians. And so this was actually one of the most recent large-scale meta-analyses that's kind of highly cited, right? That is what I would consider reliable data, right? And so this was based on 5,000 males over a bunch of different countries. Not all the way across the world. There's no South America represented in this data set, but for the most part, it's pretty widespread. And when I say 5,000 males, what that basically means is like a bunch of different researchers took a bunch of different data for their own studies that were all clinician measured. And so those are not like all 5,000 men in one study. It's like a bunch of different studies combined. And so in one study, they might have measured like flaccid penises, and another one might have studied like erect penises for whatever they were doing, right? And this study just combined all that information and said, these are clinicians, these are people who we can trust their measurements, they followed a protocol, and we're going to pull that data together. That's what where the numbers come from. So let's talk about average lengths of that data set. Flaccid penises in that data set of about however many guys was 3.6 inches long. So how long is that? That's roughly the size of a credit card in length of a credit card, right? And erect size is 5.17 inches, which is about the size of a dollar bill in length. So it's very common, I would say, to hear people talking about like 6 inches or larger. And that is specifically because of the bad reporting that is done on the surveys, because those self-reported surveys are where we got that 6 or 7 inch number specifically. And that was not clinician measured, right? That was people who said, I measured myself and this was my number, right?
These are the same guys that are actually 5'5", saying they're 5'7".
Yeah, inches,
Yeah,
exactly.
Yes, they do not know how rulers work.
Yeah. And so I tried to include the like little objects here because I think that's kind of fun, right? Like everybody has a dollar bill. That's the typical average size of an erect penis, lengthwise. Yeah.
I'm surprised by these numbers.
Yeah. I think I knew that it was around 5.
I thought it was 6.
Oh, you thought
I thought 6.
So you were probably under the impression from that survey data.
Yeah.
There were multiple studies that were trying to quell this misinformation of this self-reported data that is like altering people's perceptions.
Yeah. Because I remember thinking, how is it not just bothering you in your pants all day?
I would say that like having an erection is genuinely annoying. Like now I gotta deal with hiding myself and not like worrying about if somebody looks over and thinks I'm creeping on them because I happen to have an erection, right? Like genuinely, it's like very annoying, in my opinion, personally, right?
This episode we talked about orgasm, like the people that have the condition where they orgasm nonstop. And I was like, how annoying for a guy that then he's just ejaculating all over the place. Like there is a lot more logistics to deal with.
Yeah. Anyway, that was average lengths, and now we will talk about average girths. So you'll see that the average girth or circumference, right? So this is distance around the penis, right? At a single point is 3.67 inches flaccid, which is about the size of an Elmer's glue stick for crafts or whatever. And then at an erect stage, it was 4.59 inches. So that's like not the standard Sharpie, but like the kind of chunkier looking Sharpie that's for like bigger marks. And again, that's circumference around, basically.
So for the Elmer's glue, that's the circumference around the small?
Yeah, right. So like imagine I like followed this black line all the way around. That's that flaccid distance all the way around this tube. Same thing here where I'm like following this line of the crease all the way around in this circle.
Isn't like sometimes certain parts of a penis, the circumference is wider?
Yeah, I don't actually know where the clinician measurement for these is, but my assumption is it would probably be at the base of the penis, like as close as they could be to the body, right? That would be my guess, but I don't know. I didn't read that part of the abstract of this.
Oh, okay.
Can I add a comment
Yes.
about girth?
Yes.
My hobby is to get straight men to Google. So if you're listening to the podcast and if you're driving, like pull over to a safe location and stop, because at the Phallic Museum in Iceland, they have molds of certain celebrities' penises with their consent, of course. Jimi Hendrix's girth is the largest girth I've ever seen in my life. Like my friend and I walked in and we like you could hear a pin drop. It was like silence, gasps. And we were like, oh my God. So it's on YouTube. You can just like Google like Jimi Hendrix dick at the Phallic Museum and just look at the size of that thing. It's huge. He should be known for his girth first and his music
And then
second.
his music
Yeah.
second. Yeah.
That's how.
It's that large of a number.
Yeah.
Jimmy, buddy.
Yeah, I'm gonna look at it right now. Actually.
Yeah,
Hold on.
like not enough people are talking about
Jimi
this.
Hendrix. This plastic cast of Jimi Hendrix penis is a display model, meaning it was originally intended for display purposes only. It doesn't look that long.
No, and
But
I'm
it's
not sure
very
if it's
girthy.
soft or like if it's flaccid or erect when they take the molds. Like
They have to be. They have to be
erect
erect.
because otherwise,
Then it's harder to take off
right?
the mold. It'll be uncomfortable if they do any sort of thing. It has to
If
be.
it's flaccid.
They're at like the sex shop. You can buy a clone of Willy.
Oh,
and,
right.
And it's like but you have to be hard when you like do it. So he has to be hard.
Clone a Willy, as in it's like a plaster mold you can buy
Yeah,
at
like the
home.
average
Yeah.
guy.
To like make like a dildo or something, or
To make
like
a
what's
dildo
the?
and then you can put a vibrator in, so then you can have a vibrator of your partner's penis.
Huh.
The Phallic Museum said that they get so many donated plasters a year that they can't display them all. So like it's like unsolicited penis molds.
Man,
Yeah.
you thought dick pics were bad.
Yeah, and they get so many a year they have to like turn them away. Like, please, no more. Stop.
Swipe left.
Yeah.
It doesn't say there is a circumference.
I just had to share and get it out there.
Also
Bro.
visit the Phallus Museum in
It was so interesting. They had like different whale penises. They had raccoon penis. They had all kinds of penises.
That's awesome.
Yeah, it was really cool. And the gift shop was also really good. I actually bought a bunch of stuff, and then we like went and did something else. And I was like, I need a shirt, and so we like went back, and then I bought more.
Very cool. All right, let's talk about circumcision. So circumcision is basically the removal of the foreskin from the penis. So we didn't actually talk about that in the prior anatomical slide, but it's basically like a piece of skin that kind of sits on the top of the head of the penis. Best example for that about whether you are circumcised or not is thinking about the top of a hoodie versus a t-shirt, right? It's kind of just like this extra flap of, in this case, fabric. In this case, there is none, right? That's all. I didn't actually know I was not circumcised until like pretty recently.
You didn't know that you were?
We're not circumcised, right? Because that like it's not really like I don't know. It happens to kids when they're like less than 5 years old, right?
When
So,
they're like born.
yeah, like as a child,
Yeah.
right?
An
Like
infant.
you don't even know, right?
I am, you can cut this part out if you want. I am actually like adamantly against baby circumcision.
Yeah.
Like in the US, I think we overdo it way too much.
Yeah.
They won't be able to clean it. And it's like,
Right,
they
yeah.
have soap and water. I think it'd be fine. I think it should be like an adult male's decision to make
Yeah.
get that done.
Right.
Yeah. I also have a question. Someone, because of my stance on anti-circumcision, sent me a graphic that was like, did you know there are different cuts for different types of circumcisions that are like different parts of the world, different parts, different states of like which are more popular or less. Is this real? 'Cause
Yeah.
it was an infographic. I don't know if it was like.
Well, look, I'll look.
I don't know the answer to that.
Okay,
Yeah, I don't
that's
know
my
the
question.
answer to that. I do know that circumcision is kind of a cultural thing. Like, certain cultures have more common practices than others. Judaism and Islam are the most common religious sort of connections to circumcision, right? And in those two religions, it is an obligation for males to have their penises circumcised. However, historically, U.S. is not actually related to religious obligations, but more so hospital practices. So specifically what happened was in the Victorian times, there was a stigma or a societal misunderstanding, whatever you want to call it, that being circumcised as a kid would lead to healthier, like you said, like taking care of like risks of like STIs or whatever, right? It got introduced into the medical practices as a thing that we must do to children to encourage safety and health. And so actually, if you look at the US rate of circumcision, it's way higher than everywhere else in the world. Around 70% of male children receive circumcision in the US, as compared to Europe is like 20%, and then globally, right? So there's a lot of Judaism and Islam in the world is only 38%, right? So it's actually a significantly larger percentage. And a lot of it is actually because of those kinds of misconceptions that happened specifically in the US medical industry. And I know that is actually changing. I've actually heard conflicting information about whether it does or does not lead to any kind of an effect on sexual experience. There was some data that was showing that it can lessen the risk of certain kinds of cancers, but it's such a rare case that like it's rare that you would even have the cancer to begin with, right? And that yes, it also decreases the likelihood of getting sexual transmitted disease or infection, but that's mostly just because there's less skin, right?
So that would be like a skin to skin contact type of disease.
Right. I was actually trying to see if I could find a graph of circumcision rates over time. Couldn't find it. Doesn't mean it doesn't exist, but not from like a trustworthy site. This is from the World Health Organization and CDC, so these numbers I trust, right?
Right.
But
I do know that, yeah, when I went to Europe, a lot of more men there are not circumcised. It's not like something they do, but I did look at it, and there are actually different types of circumcision cuts and techniques. So there's either a high cut or a low cut. This describes where the scar sits in relation to the glands or the head of the penis. If it's a high cut, there's more foreskin removed, and it often leaves skin less mobile. If it's a low cut, there's less foreskin removed, and the skin is more mobile. And then there's also tight cuts and loose cuts. There's complete and partial circumcisions, but the complete circumcision seems like it's the most common. There's also a dorsal slit, a single incision along the top of the foreskin, often used in emergency situations or certain cultural practices other than cosmetic preference. Most circumcisions are tailored for aesthetic preferences.
But I feel like doctors maybe only know how to do one kind. So like in the US, maybe it's like whoever you get versus like the parents looking at a menu to
Yeah.
decide.
I think it's just generally complete circumcision in the US across the board. And then I also looked up what is the Jewish practice for circumcision, because I know it's an actual like ceremony that they do. So it's called Brit Milah. It's one of the most significant rituals in Judaism that's symbolizing the covenant between God and the Jewish people. And it originates from the Torah, which is where God commanded Abraham to circumcise himself and his descendants as a sign of the covenant. It happens traditionally 8 days after birth, even if it falls on the Sabbath or a holy day. And usually a trained circumciser called a Moel performs the circumcision. And Moels are often rabbis or doctors with specialized training. But it's like a whole ceremony where like people come together and then just...
yeah, it's like a rite of passage, right, for like a baby, right? Because I don't know how old you are when you have that happen. I guess 8 days old,
Yeah.
right?
It's often combined with the baby's naming ceremony, though. Anyway,
Yeah.
unfortunate.
I forgot to mention in the Victorian era, the reason why circumcision was originally promoted was specifically because masturbation was believed to cause disease and insanity and stuff like that.
Oh,
And so circumcision was like promoted as an initial deterrent to masturbation in young boys.
Oh, great. So they just didn't want people to masturbate because they wanted them to turn to
Right.
God.
yeah.
And
And
then,
then they were like, let's cut some of their penises off.
I just like
yeah,
I feel like when you were reading that about like Abraham, like how funny that this like all of a sudden, like he was the first one that was like, all right, guys, let's do this. And like I can't imagine how that went down. Like it's crazy that they were like, all right, let's all do
yeah,
it. Like
yeah.
no anesthesia, let's go for it.
No medical knowledge
We don't
whatsoever.
need it. I don't
Yeah.
know if this will be okay or not.
I think it's interesting too because I think there's some level of social stigma to that too, right? Because like as men who were circumcised would grow up and then they are in those locker room situations, right, where you might see a lot of other boys who were your age or men your age who were circumcised, if that is the common medical practice, then you might feel stigmatized by not having that
Right.
circumcision, right? And then I know there's a thing about like parents who would get their kids circumcised purely because of like, oh, we don't want our son to receive like bullying or whatever,
Yeah.
right? Because most people have it done as a kid for religious reasons, for medical reasons, whatever, right? But that's the majority, right?
Yeah.
And it's a very sensitive thing, and like men have bullying or whatever, right? So they would intentionally do it just so that their kids would look normal in locker rooms, right?
I've also heard, this is completely anecdotal, but I heard one person I used to know that was circumcising her son and was like, well, I want him to look like his dad. And I was like, are they going to be comparing? I don't know.
Yeah.
We need to.
I had dated someone, and I remember him telling me, he was like, yeah, I got a circumcision when I was older. Like, I got it more recently
Yeah.
because, like, I just didn't like the fact that there was some stigma against not being circumcised.
Yeah, there you go.
And so-
That's wild.
Yeah, and so he was like, it was like the most painful procedure.
Yeah.
So, like, I was like, why? For one, because it just blew my mind. I was like, you willingly put yourself through a cosmetic surgery
Yeah.
for
peer pressure.
for peer pressure, but only 0.5% of the
If
population.
that's your
in the
red
world.
flag.
Yeah.
Like, oh, you're not circumcised.
I don't see that as a criteria on,
Right.
on Hinge and Bumble.
Yeah.
And also I feel like him, because I've heard of this, like, you know, like older men deciding to go get circumcised, but we know how painful it is. Why are we doing that to little babies that are just born?
I'll have to have someone come on the podcast and talk about it because I have not experienced it, so don't know.
Yeah,
I just
good idea.
also think it's hilarious. This look back what she said about like Abraham was like this level of confidence, like we can all cut it off and we're gonna be closer to God.
I mean, if I had that level of dedication from a group of people, I would do so many other things. Like, that's power.
Yeah.
But let's do something else. That's more fun.
All right, moving on. I wanted to talk about blood. So if you think about it, we talked about how blood fills up that top half of the corpora cavernosa, right? We talked about that earlier. That spongy texture is kind of like a big balloon, right? And you're filling that balloon up. It's actually 130 milliliters of blood that can flow in there. That's half of a soda can. There's a really common misconception, I think, about like the penis being erect as a muscle, but it's not a muscle, right? It's literally just like highly pressurized blood, right? So when you're thinking about a sponge, right, it's not like you're tensing anything, right? You're not restricting or like flexing anything in a sponge. You're just literally pumping fluids in there until it's saturated. And that's what that spongy corpora cavernosa stuff is filling with blood, actually up to like 90%, right? So 90% of the blood that goes into the penis is in that spongy part on the top half of the penis that makes it
I have a
enlarged.
question. So I feel like that my understanding of it being a muscle is because of the broken pee-pee. Like, where sometimes if people are having sex and then they hit, like they miss the hole and then the penis, you know, breaks, quote unquote, like it's not a
Right.
bone. So my understanding was that was like a muscle situation. So is it the sponge that is
I don't know which one breaks. There is a fracturing that can happen there.
Yeah.
I don't know whether it's this or the undercarriage part of it.
Oh.
I don't know the answer to that. We can look at that up. Okay. But that specifically, I know that kind of thing happens specifically if like the male penis hits the pelvis, right? That's like a really common reason for that. But I don't know. I know it's.
And I feel like that's where the misconception about the muscle.
Yeah. But the actual erection itself is not. It's mostly due to this pressure from the fluid. Yeah.
So what breaks is the tunica albuginea, which is a thick membrane around the corpus cavernosa.
Oh.
That makes sense.
Okay. And the membrane itself is what breaks, which sounds very painful.
How it happens: vigorous intercourse, aggressive masturbation, rolling over onto an erect penis, or rarely from blunt trauma.
Oh.
This is probably anecdotal evidence, but they were saying that most hospital visits are from like ramming into the pelvis bone, right? And that is the most common frequent reason that goes in. Anyway, so since it's blood, right, it's actually really highly affected by cardiovascular health. So if you have hypertension or if you have diabetes or anything else that's like affecting your cardiovascular system, that can lead to effects during how much blood gets pumped into the penis during an erection, which then affects how much of an erection you can actually have.
That's where ED comes from.
Yeah, it's definitely a factor, right? So if you have a strong cardiovascular system, you're running, whatever, you probably won't have as many blood-related concerns when it comes to this part of it. So.
Fun fact that's not related to the penis whatsoever, but with menstrual bleeding, that's about 30 to 40 milliliters of blood. So there's more blood in the erection than women bleed during their period.
Half a soda can is wild to me. When I read that, I was like, what the heck? Like, that's a lot of blood.
Right, like how are you guys staying conscious?
Right,
like,
yeah.
Are bad. You guys get a break.
All right, moving on. Talking about ED, this is actually the next slide. So ED is super common. ED is erectile dysfunction. So these numbers are from the Mayo Clinic and AUA. So 1 in 2 men, that's 50% of men over 40, experience some form of erectile dysfunction. So it's like over 30 million men in the US alone. And like we said about heart cardiovascular stuff, it's a really common potential indicator for some other kind of physical health concerns. So that's diabetes, obesity, heart disease, whatever. And so I put this canary in the coal mine thing because typically if you have ED, it is not a psychological factor. It's not a thing that's wrong with your perception or your thinking or, oh, they're not into me, right? That's a very common misconception. It's usually related to other health concerns. They're stressed out. They have poor cardiovascular system. They are obese. They have heart disease, whatever other reasons, right? I think that there is a misconception when it comes to penises and having erectile dysfunction that it is some kind of lack of, interest or attraction sexually, right? And in most cases, my understanding at least, that's not the case, right?
So the ED is just in general the ability to get it up or stay hard.
It's kind of both, right? Because imagine like if I have a sponge and I fill it with blood or fluid or whatever, right? It's how long can that sponge stay saturated, right? And if there's something that like reduces your ability to pump blood in or out of that space, well, you're not going to stay hard as long, or you might not be able to fully inflate the sponge.
And like at first I thought 50% of men over 40, that seems very high. But then I thought, well, the United States, we have quite an obesity problem.
Totally. Heart disease, diabetes, exactly. All that stuff is super common.
Yeah, so I feel like in the US, I guess that makes sense. That checks out that 50% of people would have that issue.
It could be related to how common that is. So if you are with a male partner and they seem to have issues with erectile dysfunction, ask them to go to the doctor and talk about diabetes or heart disease or whatever else, because that might be the original issue. All right. That was that. So now we're going to go on to anthropology.
Before we continue,
yes.
What is the canary in the coal mine?
Reference? Oh, okay. Oh. Let's talk about canary. Okay, sorry. You can. That's
more like Cantary.
Cantary. Okay, yeah. So yeah, canary in the coal mine is a phrase, an idiom, right? And basically I don't know if this is actually true, if it actually happened. I think it did.
True.
I think it actually did. But when miners were in coal mines, they're deep in the ground, right? And there's a problem where they're really far underground. They could hit some kind of a tap in a rock or whatever, where you release some kind of gas, and it could be methane, it could be something or whatever. And miners would end up dying in these coal mines because they're in there with lower oxygen levels. So they would bring these birds, typically canaries, with them in a container. And because canaries are also breathing the air, if the canary dies, if you watch it die, it's your signal to get out of the mine, because you've seen that they're no longer able to breathe and live, so we're next, right? And so canary in the coal mine is used as like an early warning sign indicator, right? Like, oh, in this case, right, like my ED might be the canary in the coal mine for something else that's wrong with my health, right? Yeah.
I didn't know that.
Yeah, cool. An English language lesson. I don't even know we're even doing that one.
That's the Veale class. But let's be honest, there's way more to cover when it comes to the penis. Part 2 of the hard facts about the penis drops in 2 weeks. And trust me, you'll want to come back for the full package. Have any questions about human sexuality? Submit them to our anonymous form linked in the show notes. Your homework? Share this episode with a friend, because the best way to destigmatize sex is to talk about it. And if you're ready for extra credit, grab our free Essential Sex Conversations workbook by signing up for our newsletter. That's it for today's lesson. Class dismissed.
Bye.
Bye.
Bye.